right? So to give you a visual, right? The bones of the spine, 31 segments of the spine, 31 spinal bones, right, including the segments in your sacrum and your coccyx. That means 31 pairs of spinal nerves going to all the cells of your body. And in my level 1 class, we talk about how many cells there are. And we don't know how many cells there are, actually. Nobody knows. They know that it's trillions. They know that there's trillions and trillions of cells. And I'm sure Carl Sagan would be excited to hear me say that. But trillions of cells, and it ranges from 10 to 100, okay? Like, no one really knows. Some people say 10 trillion, some people say 40, some people say 50, 100 trillion. The larger the person you are, the more cells you have. You know, wonderful you. So, but the cool thing is that what's responsible for sending signals to and from every single of your cell of your body is the same in every single human being, right? And it's this thing that we're talking about, this nexus that chiropractors have been focused on since 1895, when the first chiropractic adjustment was given by a man named D.D. Palmer. Okay? Now, back then, adjustments were a manipulative force where you would press on the bones or twist them and get a popping sound, and it would reduce or move the bone back into place, right? And it would remove or eliminate or reduce the amount of interference on the nerve signal, right? So the signal could get from the brain out through wherever the bone was misaligned, out to the cell, right? So if it was here, it might go to my stomach or my spleen or my liver, might go to my mid-back or my ribs, might go to the front of my chest or my sternum. And at that time, or there's still many people that practice that way, by applying a physical force and getting a structural popping, it eliminates or reduces the nerve pressure that allows the signals to get to the cell and back up to the brain so the body can start to move back into homeostasis. What the heck did you just say? You got the idea though, right? Bones out of position, right? And that's what chiropractic, that's what chiropractic was founded on. So physical forces, right, that I just named, tend to, when the body can't adapt to a physical force, the bone is moved out of position and it can't find its way home. It's a sad story. But we want to be able to help the bones find their way, but we're going to talk a little bit about how network care actually discovered. Donnie Epstein, the man that developed network care, started to pay attention to realize that there's other factors involved. And in fact, maybe there's a more effective way at not just dissipating tension in one area, but teaching the system how to become more effective at locating its own tension, noticing a relationship between what's creating the tension externally in my world, what type of stressor, or how I might react to it internally and create tension, and how the brain can become more tuned in, more aware, and then eventually develop responses, right? Internal responses that actually help function and health and well-being to, what did I say about that research study? No limits were, they just kept on going, right? The positive perceived benefits. So the other two types of stress are chemical and emotional, right? So chemical stresses. What would be some examples of chemical stress? Hormonal imbalances, glands or organs not functioning the way they ideally should. Now, what might create that? Let's talk about external chemicals, things that could create an internal biochemical reaction like that. What was that? Drugs, yeah. Right? Doesn't matter if they're good or bad, but yeah, they're perceived by the brain. They have to detoxify them. So pharmaceutical drugs, right? So whatever we take, NSAIDs, muscle relaxers, pain meds, you name it. Recreational drugs, right? Alcohol, food, right? What we put in as fuel for the cells of our body. I talked to someone today who said, my diet is 98% organic. 98%, that's pretty amazing. I don't know how she got 98%, but that's what she said. 98% organic. And I said, where do you live? She said, oh, Santa Cruz. So what we put into our bodies can be fuel or it can be toxic, right? And so that's an example of chemical stress. Now, another one might be an external environmental stressor, like pollution, right? Someone recently started care, moved up from LA, lived beside, I forget, one of the major freeways down there. It's escaping my mind. But just a lot of respiratory distress, difficulty breathing, allergies, allergies for years, okay? So could that be considered a chemical stress, like the type of quality of air that you're breathing day in and day out? I have patients that have been longtime farmers who are organic, but they have pesticide, spraying farms in their vicinity around them. So if the winds blow in certain directions, they get gusts of like just heavy toxic loads of pesticides. So that would be an example of a chemical stress. So the point is we all experience different types of chemical stresses, right? But what I want to just say is that chemical stress and emotional stresses have a completely different reaction inside the central nervous system than physical stresses, okay? So what happens is the brain tries to take in the information through our mechanism that we talked about, and one of the things that happens is the brain at a certain point of either high intensity, so it's like one event that's just really intense, or a period of time where a certain level of something that's happening just kept going on and on and on and on and on and on. Finally, you hit what threshold is what it's called in the brain, and your brain decides, I just can't take it anymore, right? I'm done, right? And so what happens is the part of the brain that's trying to synthesize and process all that information just says, bye-bye, I'm going to Tahiti, and so good luck to you. And instead of the brain processing that part of the information, it creates a fight or flight reaction in the mid and the lower parts of the brain, and that part of the brain signals to your spinal cord to physically wind up like a winch. So it winds it up, and your spinal cord elongates. There's a covering along outside of your brain and your spinal cord called your meninges. You've probably heard of meningitis. And what happens is the brain signals to the spinal cord to stretch like this. So from top to bottom, that's what I want you to understand, is that it goes in two directions, flexion, extension, so like this, right? And then also like this, side to side. And depending on the research study that you read, the amount of mechanical tension that the spinal cord can go through is about 2.5 to 3 inches in both directions. And there's a gentleman, a neurosurgeon named Alf Brigg, and he did some incredible research about spinal cord tension. He, named the term adverse mechanical cord tension. It is definitely adverse to good health and well-being. But if you ever get a chance, you can Google him. There's amazing slides you can see. But what you see is, instead of beautiful, patent, open nerves that are they look like a river, like where water should just be flowing through them. They look stretched and twisted and thin, and like they're about ready to break. And so, being a neurosurgeon, his solution was surgery, right? And had some, in the neurosurgery, it had great results, in that realm. However, Dr. Epstein borrowed or kind of extrapolated that research and said, interesting, the meninges attach at both ends of the spine, right? In the pelvis and tailbone and the base of the skull and the neck bones. And it's the same mechanism that when the brain experiences chemical and emotional stress, the brain signals to the spinal cord to either go into a fight or flight reaction by stretching it or by twisting it, right? And the main difference is it creates a global tethering or a global stretching of the spinal nerves. So remember how we talked about how in physical stress the bones move out of position? 1 or 2 nerves are affected, right? Boom. It's like either this nerve or that nerve. It's very localized. But with the stress response, the entire spinal cord is affected, and so the pulling and twisting of the central nervous system and the spinal nerves can be affected at many, many, many locations from one end of the spine to the other. Does that make sense? Yeah. So Dr. Epstein, what he did when he kind of started putting all these things together, that he had a brilliant thought, at least I think it's brilliant, and they said, well, how can I do the least, me being the practitioner, and how can we work with the body to be able to do the most? Meaning, how can it become the agent of change? I might gently nudge the system or give it an opportunity to move in the right direction, but ultimately, how can we teach it to develop strategies that can help it, A, unwind tension at a deeper level, B, transform its capacity so it adapts differently to the same stresses that used to create distress or symptoms or tension or breakdown in the system, and then allow those strategies to keep evolving so that there is no ceiling to the benefits someone could experience, right? That's one of the things that really excited me about this work is I was in chiropractic college and I had I had an injury, really big into sports. My dad was a pro hockey player, so I played lots of sports growing up as a kid. And I was playing intramural soccer, collided with the player, we whacked each other really hard. And I was knocked out, and I really damaged the ligaments in my ankle and foot. And was seeing a traditional chiropractor, being a good chiropractic patient, but every time the chiropractor would actually sit up on my low back and thrust to try to take the pressure off the nerves, it really exacerbated the symptoms. And I would just, and I'd be like, I know it's good because we're taking the pressure off the nerves. And so a few months went by and the pain just kept getting worse and worse, and I was getting very depressed. And a friend of mine said, I think, I care about you. And I'm noticing that really you seem to be suffering, and actually it looks like you're getting worse. And in fact, you don't really seem like the same person. It's not just that you have pain. And I went, okay. She said, well, you should try my chiropractor. And she does this different type of stuff, And I was like, okay. So she said, it's really gentle. She barely touches you, and she works in this big room with other people. And she goes around, and it's like she's there, and then she's gone. I was like, okay. But I was in so much pain at the time that I said, you know what, I really don't care. If it works, it works. And so that's what got me there, right? So my experience was laying on the table. Someone did a very kind of brief exam, and she said, okay, lay down. And I said, okay. And I lay down, and then she was gone. And I was looking at her, I was like, where did she go? I heard her talking in the other room, like someone over there. I was like, well, that's weird. I thought she was working on me. Oh, okay, well. And so then she came back, and then she made these light little touches. And I went, I felt my body kind of make some shifts. And then she walked away again, and I could hear her talking in the other room. And then she came back again. And it was about the third time she came back and made really light touches on my spine that I noticed my body took like the biggest breath that I ever remembered taking. And it was like my whole body just went,